I work with so many people and I want a place that you guys can come and relax and feel good, because I know step 2 is a lot of step 1 on it. And then people sometimes take step 2 first and then take step 1 because they can. So either way, it's all intertwined. You need to have step 1 to get to step 2. If people want to take step 2 first, you can, but then you got to take step 1. Either way. So this is real. This is a lot. And step 2 is 9 hours of 8 blocks of 40. So this exam is a little less if you compare it to step 2. All right. Point is, let's get into a routine. Let's work together side by side and push hard, right? Exactly. Awesome. All right, guys. So I have 81 questions here for you guys to use in the online community. A couple things. First aid pops up. Open up first aid, right? Little things like this are important. I know when we start off with immunology, the first week, now in week 6, we have immuno, then we do micro, then we do biochem. Why do you think I start off with that? Immuno is everywhere, and immuno is at the beginning of med school. So if we figure we start off, and it's a lot easier to do and accomplish more in a short time frame because there's not that much to cover, but it allows us to get comfortable with the content, at least to be familiar with the terms, and then slowly, as we cover micro, biochem, and everything else, you start seeing more and more introduce and repeat itself in the systems, right? Just like, for example, when we do heart, lungs, kidney, you'll see micro everywhere. And I know we've touched this briefly in the past about lead poisoning with MCV, microcytic anemia. We've talked in biochemistry about this here, heme synthesis. I know we have, because I've mentioned this before, how in biochem, they ask about pathways that happen in the mitochondria and the cytoplasm and both. Well, I did give you a mnemonic way back when. I'll give it to you again. The word hug, H-U-G, you need two things can hug, right? 2 people hug when you see good morning, good night, husband and wife, parents, grandparents. So H is heme synthesis, U is urea cycle, and G is gluconeogenesis. Heme, urea, gluconeo, 3 pathways that happen in both cytoplasm and mitochondria. So this is heme synthesis, okay? And what happens is something so simple as heme plus globin is hemoglobin. So we have heme synthesis, we have globin synthesis. In this case, we have succinyl-CoA and glycine. You realize that they're going to throw a question at you 1,000%. One of you guys will get a question like this, because it can make it something so simple. And it can ask you something about the precursors, the substrates. Obviously, the substrates are this too. This is the product, heme, yeah? And if you realize some are in the mitochondria here, and some is outside the cytoplasm. So I've said this before, I'll say this again. When you have pictures like this, and there's many in your first aid, first things first, my suggestion, not memorize, because how much can you memorize? It's a lot overload here, right? Or you're going to overload a lot. I look at the substrate, what you start off with, these 2, boom. And the finish line, heme, okay. Then I'm looking at irreversible enzymes, very, very popular rate-limiting enzymes. This is very important, right? Allosynthetase, okay. And I look at cofactors. There's a B6 here, and there's, obviously we have B6, glucose hemin, okay. We have lead poison inhibits this. We have, okay, this inhibits this. PCT inhibits this level. Furokilatase, okay, lead poison inhibits this. So you look at what you start off with, what you end with, is it in the mitochondrial cytoplasm, and then clinical correlations.